Welcome to the Deep Dive. We're tackling postmenopausal osteoporosis today, diving into the 2020 guidelines from the American Association of Clinical Endocrinologists.
It's a really dynamic field, so staying updated is key.
Absolutely, and it's not just theoretical. Osteoporosis has such a huge impact on so many people's lives. These guidelines are all about making a real difference for patients.
Exactly. For endocrinologists, really understanding the nuances is crucial. Like the new risk stratification system, it goes beyond just categorization now.
Oh, interesting. So it's not a one-size-fits-all approach anymore.
Not at all. It's about tailoring treatment, even the initial medication, based on individual risk factors, especially looking at prior fractures.
More personalized medicine, that makes sense.
Precisely. And even the treatment duration is adjusted based on that risk profile.
I see. So how does that work in practice? Can you give an example?
Sure, take romosozumab, for example. It's an anabolic agent that's now part of the treatment algorithm.
That's a big deal, right?
Uh-huh.
I remember when it first came out, there was a lot of excitement about its potential.
Absolutely. And these guidelines don't just say, here's a new drug. They really delve into the specifics.
So it's about using the right tool for the right job.
Exactly. They compare its effectiveness to other options in specific patient groups. Like in patients with multiple prior fractures, the data on romosozumab reducing new fractures is really quite compelling.
Okay, now that's what I'm talking about. Actionable insights. But before we get too deep into treatment, let's rewind a bit to diagnosis. We've got the WHO criteria, the T-scores, but I'm sensing there's more to it.
You're right. T-scores are important, but they're just one piece of the puzzle. We need more context.
Like what?
Well, that's where the FRAX tool comes in. It calculates the 10-year probability of hip and major osteoporotic fractures, looking at a range of clinical risk factors, not just BMD.
It's about connecting the dots, right? You could have a patient with a normal T-score, but their FRX score might raise a red flag.
Exactly, maybe due to family history, lifestyle, or other underlying conditions.
And that's where you'd adjust the management approach.
Precisely. And it's important to be aware of FRX's limitations, too.
Oh, like what?
Well, it might underestimate risk in certain situations, like patients with multiple prior fractures, recent fractures, or a high risk of falling, which is a big concern, especially as patients get older.
It's true, falls can be so unpredictable, but minimizing their impact is key. Speaking of which, I noticed the guidelines really emphasize detecting vertebral fractures.
Yes, and those can be tricky because they're often silent. You might not even know they're there if you're just looking at a T-score.
So someone could have a seemingly okay bone density, but a vertebral fracture changes everything.
Exactly. It highlights that diagnosis isn't just about a number, it's about the whole picture, their bone health, medical history, individual risk factors.
Being a bone detective. And that detective work continues with treatment, I imagine.
Absolutely. We have a lot of FDA-approved agents now, but the 2020 guidelines are all about moving away from that one-size-fits-all approach.
Makes sense. So how do you navigate all those options?
That's where things get really interesting. The guidelines delve into the nuances of different medications and their applications in specific scenarios.
So more tools in the toolbox, but knowing which one to use when.
Exactly. For example, there's a lot of debate right now about anabolic versus anti-resorptive therapies, and the guidelines even address some emerging data suggesting that in certain cases, anabolic agents might be the better choice, like in patients who are on long-term glucocorticoids.
Right, because that can really take a toll on bone density.
It really can, and in those cases, the guidelines highlight studies where anabolic agents, specifically teriparatide and romosozumab, they showed greater gains in bone mineral density compared to anti-resorptive therapies.
Oh, wow. So a significant difference.
Yes,
Yeah.
and even a reduction in new vertebral fractures, which is huge.
That's really impressive. So it's about choosing the treatment that not just slows down bone loss, but actually helps rebuild bone.
Exactly, and this focus on individualization, it goes beyond just the medication itself.
In a way.
Well, it's about looking at the whole patient, their fracture risk, any other medical conditions, even potential challenges with adherence.
Right, because if someone struggles to take their medication as prescribed, that's a huge factor.
It really is, and the guidelines acknowledge that. For example, they talk about how for some patients, a medication with a less frequent dosing schedule could make a big difference in terms of adherence.
Absolutely. It's about finding a treatment plan that fits into their life, not the other way around.
Precisely. And speaking of fitting treatment into a patient's life, let's talk about monitoring. Because once treatment is underway, we need to know if it's actually working.
And that can be tricky, right? Interpreting those BMD results, it's not always straightforward.
You're telling me it can be like trying to read tea leaves sometimes, but the guidelines do offer some helpful guidance there.
Like what?
Well, they emphasize the importance of considering the least significant change, the LSC.
Ah, yes, I remember learning about that. It helps you cut through the noise, right?
Exactly, because it's easy to get caught up in small fluctuations in BMD, but the LSC helps you determine if a change is clinically meaningful or just part of the natural variation you see with those
You were
measurements.
not chasing numbers. We're looking for those real significant changes.
Exactly. And that leads us to another interesting concept the guidelines discuss treat to target goals in osteoporosis management.
Oh, yes. I was intrigued by that. It seems like a more proactive approach.
It is. It's about shifting the mindset from just trying to slow down bone loss to actually aiming for specific, measurable outcomes.
So instead of just preventing things from getting worse, we're actively trying to make things better.
Precisely. Think of it like managing other chronic conditions like hypertension or diabetes, where you have those clear targets like achieving a certain blood pressure or blood sugar level.
It's about setting the bar high and working together, both the clinician and the patient, to reach that goal.
Exactly. And I think that's a really empowering message for patients.
It is, but I imagine it's not always easy to determine when a treatment isn't working. When do you say, okay, we need to switch gears?
That's a tough one, and the guidelines address that too. They talk about the importance of not overreacting to every little change, but also recognizing when those changes might be a sign that something's not right.
So it's about finding that balance, being vigilant but not overly aggressive.
Exactly, and they specifically mention that a single fracture during treatment isn't necessarily a cause for alarm.
Because it could be due to other factors, right? Like a fall or something.
Exactly. But two or more fragility fractures, now that's a different story, that would definitely warrant a closer look at the treatment strategy.
So it's about looking at the overall pattern, not just isolated incidents.
Precisely. And all of this leads us to another crucial aspect of osteoporosis management long-term safety.
Because we can't talk about treatment without acknowledging those concerns.
Right, and the guidelines do a good job of addressing those concerns head on.
Like what?
Hmm?
What are some of the key takeaways there?
Well, they talk about the risks of long-term bisphosphonate use, specifically ONJ and AFF, which are serious complications, but they emphasize that the incidence in the context of osteoporosis treatment is actually very low.
So it's about putting those risks into perspective, right?
Exactly, especially compared to the much higher doses of bisphosphonates used in cancer treatment, for example.
Right, the risk-benefit ratio is completely different.
Exactly. And the guidelines also discuss the rationale behind drug holidays, specifically with bisphosphonate.
Oh, that's interesting. So taking a break from treatment after a certain period.
Precisely. The idea is that interrupting treatment for a while, based on the patient's individual risk factors and bone health, can help mitigate potential risks while still providing significant benefits.
So it's about finding that sweet spot, right? Maximizing the benefits while minimizing any potential downsides.
Exactly. It's a balancing act for sure. And it highlights the fact that there's still a lot to learn when it comes to long-term osteoporosis management.
Like, what's the ideal duration of treatment? Is there a magic number?
That's the million-dollar question, isn't it? And unfortunately, there's no easy answer. It goes back to that idea of personalized care. What works for one patient might not work for another.
Right, because everyone's bone health journey is different.
Exactly. And the guidelines acknowledge that. They emphasize that there's no one-size-fits-all approach when it comes to treatment duration.
So how do you navigate that uncertainty then? What factors do you consider when making those decisions with your patients?
Well, it's about taking everything into account, their age, their fracture history, their overall health status, how well they've responded to treatment so far, their preferences, of course. It's a shared decision-making process.
It sounds like it's as much an art as it is a science.
It really is, and that's what makes it so challenging, but also so rewarding, because when you get it right, when you find that perfect balance for each patient, it can make a world of difference in their lives.
Absolutely. Well, we've covered a lot of ground today, from risk stratification to treatment options to long-term safety considerations. It's clear that osteoporosis management is a constantly evolving field.
It certainly is, and these 2020 guidelines provide a really valuable roadmap for clinicians.
They do, but they also highlight the fact that there's still so much more to learn.
Absolutely, and that's what makes it so exciting. There's always something new to discover, always room for innovation and improvement.
Well said. And on that note, I want to thank you for taking this deep dive with us today. It's been a pleasure picking your brain.
My pleasure. Always happy to talk about bone health.
And to our listeners, thank you for joining us for another episode of The Deep Dive. Be sure to check back soon for more in-depth discussions on the latest medical advancements and guidelines. Until next time, stay curious.